Now let's head to the south of the continent, where hundreds of nurses at Zimbabwe's government hospitals on Monday commenced an indefinite industrial action to demand higher pay and improved working conditions. The strike follows a worsening economic crisis that has seen thousands of health workers leave public service in the last 3 years.
The cost of food and services has doubled recently owing to the war and in Ukraine, and the annual inflation in the country reached just 130%, over 130% in May. Union leaders have acknowledged that patients may die as a result of the strike, but say they are left with no option following the government's refusal to engage them.
They allege that the country's public health system has collapsed over the last 20 years due to neglect and poor administration.
Let's also add that on Monday, teachers in the country also called a 5-day strike, according to a statement from the Amalgamated Rural Teachers Union of Zimbabwe. They say, and I quote, "We cannot continue to be an embarrassment in our community as a result of the poverty that the government believes should remain as part of our working lives," quote closed. These are very uncomfortable conversations, but very important. We must constantly provide for the needs of our nurses and our doctors, our medical professionals, our medical personnel. Their importance cannot be underestimated in our society today. Imagine the number of people that will die, unfortunately, in the short duration. Even if the strike is just for a day, there are people who will have emergency situations that may not be able to get help and may die from there.
Yeah, I always say that, the problems in African countries mirror each other. It feels like there's the same thing happening in the north and in the west and southern part of Africa, everywhere. Pretty much the same stories, left and right. And it really, it calls to question, how much, African governments invest in certain things, invest in education, invest in healthcare, invest in security, invest in infrastructure. I don't know if we will, ever get to a place where these things are no longer parts of, a major conversation, because they are now normal. They are now, the most basic things that you would expect to find. We start to have conversations about a higher level of, human life, basically.
I mean, why a lot of that can't happen is because we see that, unfortunately, a lot of African leaders do not get healthcare from their countries.
No, they don't.
They get healthcare from the West. So when you know that if you have an emergency, you can hop into your private jet, fly out of the country and get treatment outside. You would not invest in building your own healthcare. Even in the education sector, a lot of their kids are schooling abroad. So why should they bother as much in ensuring that these sectors are working?
I agree. But of course, we'll look deeper into, some of the reasons these Zimbabwean nurses are, seeking or making these demands, and so also see, the moves that the government has also put in place over time. It's an ongoing conversation. We, of course, hope that the strikes are called off soon enough, so patients don't get to suffer or bear the brunt of these issues.